All right. Well, good afternoon, everyone, or whatever time zone you're in. I'm excited and delighted to welcome you to the first in our new series of webinars sponsored by the Rutgers Institute for Corporate Social Innovation. I'm Gina Wertenberg, and our topic today is climate justice, advancing health equity in the face of a changing climate. Before I introduce our two outstanding speakers today, I'm going to say a few words for roughly 10 minutes to set the context. As some of you may remember, we hosted a two-day Inclusive Impact Summit on the three themes of climate justice, health equity, and shared prosperity. Deb can put the link in chat for all the recordings from that two-day series of amazing speakers. Now we're doing deep dives into each of these topics with organizations that are leading the way. And today we're delighted to have Phil Dahlin, Global Director of Sustainability from Johnson & Johnson, along with Kristen Stevens, the Director of Climate and Disaster Resilience at Americares, to share their thoughts and experiences. A key framework for guiding business risks and solutions is the World Economic Forum and their Global Risks Report. The report is an annual study published ahead of the forum's annual meeting in Davos, Switzerland. The risks are grouped into 5 risk categories: economic, environmental, geopolitical, societal, and technological. The risks are ranked by both their likelihood to occur and by the magnitude of their impact. Here we see the greatest environmental risks in green. Number 1, climate action failure, which is what we're talking about today. Number 2, extreme weather. And number 3, biodiversity loss. And those are the top 3. And the greatest societal risks over the next 10 years are around social cohesion erosion, livelihood crises, people losing their livelihood, and infectious diseases. On the next slide, you see that climate change is the single biggest health threat facing humanity. And health professionals worldwide are already responding to the health harms caused by this unfolding crisis. The Intergovernmental Panel on Climate Change, IPCC, has concluded that to avert catastrophic health impacts and prevent millions of climate-related deaths, the world must limit temperature rise to 1.5 degrees centigrade. Unfortunately, past emissions have already made a certain level of global temperature rise and other changes to the climate inevitable. And we're seeing increasing evidence of that every day. Global heating of even 1.5 degrees centigrade is not considered safe. However, every additional 1/10 of a degree of warming will take a serious toll on millions of people's lives and health. There was actually a New York Times article on that today. So within this context, what is climate justice? Climate justice, on the next slide, is all about climate-sensitive health risks. And this chart is an overview of climate-sensitive health risks, their exposure pathways, and vulnerability factors. As you can see, climate change impacts health both directly and indirectly, and is strongly mediated by environmental, social, and public health determinants. Climate change is already impacting health in myriad of ways, including by leading to death and illness from increasingly frequent extreme weather events, such as heat waves, which we just experienced, storms and floods, the disruption of food systems, increases in zoonoses, which is a disease which can be transmitted to humans from animals, and food, water, and vector-borne diseases, as well as a host of mental health issues. Climate change is already undermining many of the social determinants of good health, such as people's livelihoods, equality, and access to healthcare and social support structures. These climate-sensitive health risks are disproportionately felt by the most vulnerable and disadvantaged, including women, children, ethnic minorities, poor communities, migrants or displaced persons, older populations, and those with underlying health conditions. Sadly, while no one is safe from these risks, the people whose health is being harmed first and worst by the climate crisis are the people who contribute least to its causes and who are least able to protect themselves and their families against it. People in low income and disadvantaged countries and communities. So climate justice is a term that refers to both the moral and ethical implications of climate change. Climate justice is intended to call out that beyond the evidence-based environmental and physical impacts on our world, climate change is happening now and to all of us. No country, no community is immune, said UN Secretary General Antonio Guterres. And as is always the case, the poor and vulnerable are the first to suffer and the worst hit. So environmental and climate justice is also a civil rights issue. We all depend on the physical environment and its ecological services and resources. Historically, New Jersey's low-income communities and communities of color have been subject to a disproportionately high number of environmental and public health stressors, including pollution from numerous industrial, commercial, and governmental facilities located in those communities, and as a result, suffer from increased adverse health effects, including but not limited to asthma, cancer, elevated blood lead levels, cardiovascular disease, and developmental disorders. Toxic facilities like coal-fired power plants and incinerators emit mercury, arsenic, lead, and other contaminants into the water, food, and lungs of communities. So what do we do about these issues to address them in a way that is at once strategic and impactful? After the webinar, we will be sharing information and links with valuable information on what leading companies are doing to address these critical issues. These are some of the organizations that are stepping up to the challenge, and there are many others. Today, we'll be discussing in depth Johnson & Johnson's and Americares strategies and initiatives. So as we analyze the common themes that organizations are using to support climate justice, we discerned 5 key themes shown here. First, reduction of harmful emissions, particularly greenhouse gases, as I've discussed. Second, advancing energy efficiency and clean energy. Third, strengthening community resilience and livability. Fourth, spreading awareness and environmental and health-related issues affecting local communities. And fifth, supporting new laws that protect communities and the environment. By the way, New Jersey is one of the first in the nation with such laws being enacted. Now it gives me great pleasure to introduce our speakers for today. Philip Dahlin, Global Director of Sustainability at Johnson & Johnson. Phil leads Johnson & Johnson's environmental health strategy development and execution and develops partnerships that aim to improve environmental quality and human outcomes in support of J&J's broader mission of improving global health. Phil also co-leads J&J's Environmental Policy Council and is responsible for J&J's company-wide approach to encourage the design and development of more sustainable products and solutions. He joined J&J in 1999 and worked previously in the waste management sector, as well as serving as Environmental Science Officer in the U.S. Army Civil Affairs Corps. Phil holds a Bachelor of Science degree in Environmental Science from Syracuse University and SUNY College of Environmental Science and Forestry, and a Master of Public Health from the University of California at Berkeley. Next, we have Kristen Stevens, the Director of Climate and Disaster Resilience at Americares. Kristen oversees the strategic direction of Americares resilience programming in the US and around the world. She's responsible for designing and implementing programs that provide health centers with the tools to prepare for future disasters and the impacts of the climate crisis. Prior to joining Americares, Kristen served as principal and founder of Stevens Research and Consulting, where she provided consulting services in emergency management, health security, disaster risk reduction, and business continuity to a variety of healthcare, nonprofit, and higher education organizations. Stevens also served as a disaster risk reduction technical advisor for Americares in Nepal and worked as director of emergency management for NYU Langone Medical Center, where she oversaw the emergency management program for 3 hospitals and the NYU School of Medicine. Please join me in welcoming our wonderful speakers. All right. So at this point, I'm going to ask some questions, and we're going to keep the rest informal, no more PowerPoints. So first, I would like each of you to share a little about yourself, your career, and how you got into this area, And specifically, why is climate justice important to you personally and professionally? I'm going to start with Phil.
Thank you. So as you mentioned, I'm Phil Dahlin, Global Director of Sustainability at J&J. You covered a fair amount of my career already, so I'll try not to repeat too much. But I have spent basically my entire career in some capability related to environmental issues. And I've worked on the environment from the environmental science perspective, from an engineering perspective, from a policy perspective. I've worked on issues like responsible supply chain, sustainability strategy, and now a lot of my focus is in this intersection of environment and human health, or environmental health. As to how I got here, I'd say it's a bit of being in the right place at the right time, but sustainability is a relatively new field, so I've had to create kind of my own vision and roles along the way. But as far as climate justice, and this is a newer area that I've been working in, but you mentioned, right, that the people that have least contributed to climate change are the ones going to be most impacted by it. And I think just, on a personal level, being raised to be kind and fair, when I see injustices like this, it just, triggers very strong emotions in me and drives me to action. And, from a professional perspective, I'd say, at Johnson & Johnson, we've got a strong focus on health equity and, of course, sustainability. And I think, I feel very fortunate to be in a professional situation where my, personal values and professional values line up. So I'll stop there. Turn it over to Kristen.
Great. Kristen?
Yeah, thanks so much. And thanks for having me today. So I've been in the field of emergency management for about 15 years now, and I've been working in and around the health arena for a bit longer than that. For me, I've always been interested in how larger dynamics impact communities and in how people organize themselves to respond to large-scale situations, whether these are issues at the community organizing level, justice issues, to large-scale disasters. And it turns out that my professional niche was really on the emergency management side and looking at these large-scale disasters. It all sort of comes full circle, though, when we start talking about environmental justice, climate justice, because these are at the heart of it all. These are community issues. These are community-based issues that are impacting people day in and day out. And then these large-scale disasters that we see come and make challenging situations even more challenging. So it sort of brings all of that together. And like Phil, I also have a profound sense of fairness. Justice and fairness are incredibly important to me. And so those are big drivers for me of, how do we treat each other? How have we designed systems intentionally or unintentionally that marginalize people, and what can we do to mitigate that? And what can we do to continue to level that playing field and undo the wrongs that have been done?
So I see that these issues are at a very personal level, and you've been able to find careers where you can really make a difference, as we'll be hearing throughout, and address some of these issues at a very profound systemic level, which is awesome. So let's explore how organizations like Johnson & Johnson and Americares can partner to make a difference, particularly to those most in need at the local level. So can you tell us more about your work in this space, specifically the Climate and Health Equity for Community Clinics initiative that was supported by J&J? And how does it work to help those in greatest need? And what has your experience been in working on this initiative?
So I can start with that one. So okay. I'll back up a little bit. So I've been responsible for the development of our strategy to address this nexus of environment and human health for probably 6 or 7 years now. And early on, we realized like our ability to drive meaningful change was very limited if we didn't reach out beyond our four walls. So partnerships became an early cornerstone of our strategy there. And, since we started our journey in trying to address environmental determinants of health, we've been looking at how issues like climate change impact specific health outcomes and what we might do to improve those health outcomes. So looking at like how climate change impacts cardiovascular and respiratory disease or infectious disease burden or mental health. But along the way, we came to the realization that climate change is not only impacting health, but healthcare, right? So climate change has that ability to, impact access to care, impact the continuity of care. And then when you look at the parts of the healthcare system that are most vulnerable to the impacts from climate change, it's in these communities that rely on local community health centers for access to care. So as we kind of had this realization, at the same time, Johnson & Johnson had launched a race to health equity and developed some really bold goals to address health equity gaps here in the US. And that's backed up by $100 million in investments. But we decided, we could contribute to these efforts by addressing disproportionate impacts of climate change on communities of color and how they access healthcare. So coming back to the partnership strategy, when we started to look at potential partners to work with to promote health equity in a changing climate, Americares was perfectly positioned to be the partner of choice. We also realized, I guess, in kind of building this initiative that we need some academic firepower on the project as well. So we've had a long-standing relationship with the Harvard Chan School of Public Health and with the Sea Change Center located there, the Center for Climate Change and Climate Change, Health, and Global Environment. I always get it. And I know you guys at Americares have had a working relationship with them as well. So, we decided to bring them on board. Let me stop there. I'll not steal all the thunder.
Okay. So, Kristen, can you tell us a little bit more about how the partnership works and your experience in working in this cross-sector initiative?
Sure. Thank you. So at Americares, partnerships are the foundation of all the work that we do. So for those of you who don't know, we are a health-focused relief organization. We are focused on alleviating the impacts of poverty and disaster. And we work with networks of local health centers around the world. We work in over 90 countries with over 4,000 health centers around the world in varying capacities, some of them with product donations, some of them with full-on programs. It's a wide variety of things that we do. But none of our work would be anywhere without partnerships. So we partner with health centers at the local level. They are the ones, they know their communities the best. They know their patients in and out. One of the things that's most important to me when I think about response to the global climate crisis is that it is a global crisis. But at the community level, it's personal. It's individual people being impacted. And the health centers that we work with, they know their patients. In conversations we've had with them, when we've talked about things like heat waves, they know which patients of theirs can't come to the clinic because they take the bus and it's too hot for them to wait outside at the bus stop, right? Or they walk to the clinic and it's too hot for them to walk to the clinic. And those are the real disruptions of care that are personal and that are known to the people working in the clinic, to their patients. And that's why to really get any real traction on this kind of work, you have to be deeply embedded with these partners in these communities. So our partnership with Sea Change, Harvard Chan Sea Change, as well as J&J, is really seeking to help alleviate some of these impacts. J&J has been a longstanding partner of Americares for 20 years now, more, probably more. And for me, this is the kind of, this is the kind of partnership that we seek out. it's not just a partnership that's about writing a check. It's about connections. It's about resources. Phil sends me things, articles that he think might help, right? He sends me research that he's found. It's about, the global crisis is so large. It's an all hands on deck emergency. So when you have somebody who can be helping out and who can be making sure that you're seeing the best of what's out there. And the beauty of this project is that we are able to take the partnership between our three organizations and distill it into actionable strategies at the local level. And that's the goal of it, is we're trying to increase the resilience of the health centers that we're working with to try to decrease the impact of the climate crisis in their communities, right? Because we know that people who are vulnerable day to day are most vulnerable to the impacts of disasters, are most vulnerable to the impacts of the climate crisis. So if we can have stronger health centers day to day, we help to reduce that gap, narrow that gap for getting care, getting treatment, maintaining continuity of care and health.
Fantastic. I just wanted to mention to everybody, if you want to chat any questions, just put them in the chat, and we're going to have some time for Q&A towards the end. Let me ask a related question to what you were just saying. What do you see as some of if you were elevated to sort of the underlying principles that contribute to the success of your program at the local level? What are some things that can be done and are being done?
So our project is still in the development phase. So we've been working with some, identifying some initial partnerships in some key states. We are seeking to partner with health centers from the very beginning in the design of the project. Even at the point of, as we've designed the needs assessment, getting feedback from health centers on the needs assessment itself, to make sure, are we asking the right questions, right? Because, expertise lies in different areas. And so we want to make sure that we're leveraging the knowledge where it sits. We're leveraging that real community-based feeling of it, because that's going to be, that's our grounding principles, is that it has to be embedded in the community. It has to be flexible for them. It has to work for them. This isn't something that we can just put in as a one size fits all and plop down anywhere, right? Because communities are different. They face different challenges. They have different populations. They have different needs. These health centers might be organized differently from one another. They might have a whole variety of different factors that make them different, but they're all facing a lot of the same underlying challenges. So we keep the goal in mind and are looking to develop strategies that can be tailored to meet them where they are and help advance the situation from there.
Excellent, thank you. Phil, would you like to comment and anything on the challenges that you're facing and possible solutions? Some of these?
Before that, I'll touch on the principles, because I think, one of the things we are focused on is to make sure that, we're very targeted and we get to the right clinics. And so we've been looking at this, intersection of, where are the areas that are most vulnerable to climate change, as well as the areas that have kind of the highest social vulnerability. And fortunately, over the last few years, there have been developments of some tremendous tools, especially at the federal level, like the CDC has developed a social vulnerability index to really identify communities most at need. EPA has a climate change impacts and risk analysis framework. So there's all these tools that we can leverage that we don't have to recreate the wheel, but by overlaying them all, almost getting into kind of GIS, territory, we can really identify those clinics in the areas that are most vulnerable from multiple perspectives. Unfortunately, those areas kind of continue to expand those overlays. So we have to look at, kind of the most vulnerable, but that's definitely one of the principles, is to be very targeted in that assistance.
Is big data part of that? The analytical, we have a lot of students studying big data and how to leverage it for social impact.
Sure. I mean, but that's on the back end of these tools, right? So we're not, Kristen and I aren't crunching through,
Of
large
course.
databases and
But we're
designing
profoundly
algorithms,
grateful.
but yeah.
Exactly.
But
But
that's
we're
a tool, right?
exactly. And that's been, in my years in this field, that's been one of the biggest gaps is that data. So the advances that we've seen around data, and just the fact that we can do this kind of overlay as it is a huge change, even from 5-10 years ago. So, for your students out there who are involved in big data, it's people need actionable information, and they need it presented in a way where you can pop in a zip code, where you can pop in this. It's, we don't all have the time or capacity or skills to do all of that work ourselves, but we desperately need that information because this is a global emergency. There is a lot that needs to be done, and there are people at risk. So the more we can use data to hone in on, where can we do the greatest good for the greatest number of people is key.
Yeah.
Absolutely.
But there's, data gets us so far, and then you need those relationships, right? At
Exactly.
the local level. So it's
Right.
the blending of the two.
Exactly.
Absolutely. Can you give an example of, for example, with IDA, how that played out at the local level in terms of breaking down knowledge that's actionable to deal with the crisis at the time?
Well, I was just reading about Jackson, Mississippi too. I mean,
Yeah.
there's, in terms of some of the challenges, I mean, we are, the goal of this project is to really build resiliency in these clinics so that they can better withstand, chronic and acute impacts of climate change and continue to provide those critical health services. We're focusing on this from a, building operational and personnel resiliency and hopefully to some effect patient resiliency through outreach. But a major challenge that remains is that these clinics will likely require some sort of, significant infrastructure investments as well to withstand, the effects of hurricanes or flooding or wildfires, even extreme heat waves and drought. And it's, not only the clinics that need these investments, but the communities that they're in as well. And so that's what kind of made me think about Jackson, Mississippi, right? It's, the water systems need infrastructure investment and, and sewage treatment and everything else. And it's not just Jackson, right? So I was reading a report this morning, I think it was through ABC News, that was highlighting all the ongoing water crises across the US. There's arsenic in the water in New York City in public housing, there's E. coli in Baltimore water. So, we can't address those infrastructure needs through a project like this because it's just, the scope is just, and scale is, enormous. Those need to be addressed through local, state, federal policies and funding there. But, what we can do somewhat through our project is identify those most critical, investment needs from an infrastructure perspective as well, in those community clinics that we are engaging with, so that they have that needs assessment, when funding is available. It's like, hey, we know exactly the infrastructure investments we need. So hopefully that's one thing that we get out of this project. But
Excellent. So, Kristen, did you want to say anything else about the challenges you're facing? Any thoughts on some of the possible solutions to address these challenges?
Yeah. So one of the things I do want to say, just to dovetail on what Phil was saying about Jackson, is when we're talking about challenges that we're looking at now and into the future, Jackson is something that we should all be paying attention to, because one of the, it's obviously a water crisis, it's a public health crisis, it's, all of that is clear. But one of the big things that concerns me is looking at the migration out of the city of Jackson over recent years. So as infrastructure started to fail, as things became more challenging in the situation, people who could afford to leave did leave. And that decreases the tax base and it makes the problems worse. And that is something that we have seen following disasters for years, right? So, people who have the means to evacuate an area in advance of a hurricane do, and they might not come back. And we did a lot of work at Americares in the Caribbean and in the Gulf states following the 2017 hurricanes. That was the year of Harvey, Irma, and Maria back to back. And at one point when I was in the Virgin Islands, at one point there was no cancer care anywhere in the Virgin Islands. There was only one psychiatrist in the Virgin Islands, right? Because people who could afford to leave did go, right? And and I understand that some of the services have been restored, but there is a tremendous gap left behind as people migrate out. And so this exacerbates the inequalities because not everybody can afford to leave. And now all of a sudden they couldn't afford to leave. And now all of a sudden they can't also afford to fly themselves to Miami for cancer screenings or for cancer treatment, right? I mean, it's this way of making challenging situations even more challenging. And I think we all need to be paying very, very close attention to Jackson, because we need to expect that there's going to be more of this kind of migration out of areas as the climate crisis gets worse, and do our best to mitigate that, because it's this is a natural phenomenon that's been happening for years, and we're still seeing it today. So I just wanted to call that out.
And
Absolutely.
not to pile on challenges, just want to add one more thing, because, and this is kind of unrelated to climate, but we're just coming out of 2 years of battling the COVID epidemic. So the people in the clinics are exhausted.
Yeah.
The people that are still there in the clinics are exhausted. Clinics have lost staff. Some are operating on skeleton staff. And while we're bringing this tremendous program to help them, the people that have maybe a little bit of resources can, afford to take on that help, but some may not be able to take on that help right now just because of the sheer reality of what healthcare personnel look like after COVID for 2 years. So.
Absolutely. So there's tremendous challenges, and let's
Not easy.
talk a little bit about some of the high impact strategies and workable solutions, especially in communities where health disparities are stark, that you see, and how can some of these be scaled up?
So for me, it all, and I know I've already sort of been hammering on this, but for me, it's all about partnerships, and it's all about relationships. There is great work already happening in a lot of communities, and those efforts need to be supported and magnified. People need to use whatever resources they bring to the table. There's an old saying in emergency management that when a major disaster strikes, the biggest challenge is getting big enough, fast enough, right? Because nobody ever has all of the resources that they need just sitting there on deck waiting for something to happen, right? The climate crisis, this is an all hands on deck moment. And so this is a moment where people need to bring whatever it is that they have to the table. So we need to be able to leverage whatever it is that somebody can bring. Do you have initiatives that are community initiatives that are already underway? Do you have money that you can donate? Do you have space that you can donate to allow others to meet and organize? Do you have influence? Do you have leverage? Do you have technical skills? Do you have, no matter who you are, everybody has something to bring to the table. And so I think that's one of the most important things, is that there is a lot of great work going on at the community level, but until they can get bundled together and until they can get brought to scale, right? Scaling initiatives is always incredibly challenging, but that's what's needed. And we need to be able to amplify work that's happening, and trusting people who are working at the local level. They know what they need. People know what their communities need, but there is often an enormous gap between what they need and what they can get. And that's where the power of partnerships can come in, because how can we all help to fill those gaps?
So I love how you said it's all hands on deck and everyone has something to contribute, because most people, or I would say a lot of people, just sort of sit there thinking, well, other people know what to do. I don't know what to do, or I have nothing to contribute. And everyone has a role to play in this.
Everyone has a role to play.
Absolutely.
Yeah.
So Phil, did you want to add anything to that?
Yeah, just, we hope that coming out of this project, that we can, extend the learnings to a broader, swath of clinics, and take the successful interventions that we've identified and help other clinics apply them. I mentioned the COVID crisis, right? So, we realized like, hey, there are going to be clinics that can't participate, but there might be healthcare professionals at clinics that are really interested in the topic and want to kind of be, ambassadors for this topic and learn more and figure out how they can, change things within the operations of their own clinic. So, even since we launched this, we're already evolving the project a bit because of that. So, we intend to build in parallel, cohort of clinical, healthcare professionals that can act as those change agents. And, and then we can also hopefully leverage the power of some of their professional networks like the, National Association of Community Health Centers to really amplify, the messages, the learnings, and share it more widely.
Exactly.
Great. So we're going to be identifying learnings from this, high impact strategies, workable solutions, leveraging them and scaling them as a result of an ongoing kind of action research learning process. Great. I wanted to ask Kristen, can you speak to some of the unintended consequences of actions that where you have good, well-meaning people, but they're actually making things worse?
Yeah, I mean, there's a number of ways that, there are a number of ways that challenging situations can be made more challenging. And some of it is well-meaning and some of it is thoughtless or otherwise. But, there are environmental challenges are more challenging in some communities than in other communities. And that's at the heart of environmental justice. That gets to where and how waste is processed. That gets to where, city buses idling in poorer neighborhoods, right? Reducing the air quality of those neighborhoods. Government decisions about land use, right? So lack of green space in urban environments contributes to a heat island effect. There are decisions that are made without looking at the whole picture of what the downstream implications of this are. And there's also a history in this country of more deliberate efforts that have made issues more challenging in specific communities. The other thing to keep in mind, though, is that these are all actions that there is remediation available for them, right? There are things that people are doing today that have negative impacts on communities that can change, that people can change the way waste is managed. People can change, why are those buses always idling anyway, right? And why are they doing that there? We're looking at things like, investments in communities. So I was on a call yesterday with somebody from California, a pediatrician from California, and she's done a lot of work around school resilience. And she was talking about the fact that in California, schools are closing due to heat and air quality issues because there's no air conditioning in the school, right? Well, what happens to the children's right to an education? What happens to their education? Also, it doesn't, just because they're not in school doesn't mean that they're going home to an air conditioned home, right? And in many ways, it would be better for the children's health if we were making the schools themselves better, right? Installing the air conditioning in the school, at least they're in a better, healthier environment during the school day and they're not having their education disrupted. So there are so many things like this that are, at the time when those schools were designed, it was perfectly appropriate for them to not have air conditioning, right? The environment was different. It wasn't needed, but it is now. And so, that wasn't a poor design at the time, but it's something that hasn't held up over time. And so that's something that needs to be managed. And the kids can't keep paying the price for that.
Absolutely. So these are some systemic changes looking at the whole picture from the current and future circumstances, not 50, 100 years ago.
Exactly.
Thank you. Phil, did you want to add anything to that?
The schools, it's funny because that actually, instantly that became politicized with schools, having heat emergency days. And, it's like, oh, when I was a kid, we didn't have days off for heat. It's interesting how that got politicized, but 50 years ago, we were also talking about a mini ice age and things like that. The climate definitely wasn't the same. So people
Right.
to,
Okay. Phil, I wanted to
But,
ask
yeah.
you if you have any thoughts about the new Inflation Reduction Act,
Sure.
aka Climate Justice Bill.
Yeah, I've taken quite a deep dive into the IRA. I also work on environmental policy, so I was working on this beforehand. But primarily it's focused on climate mitigation, right? So through increasing, renewable energy production, access to renewable energy, reduction in air pollution, advancing low carbon transportation. All these will deliver significant health benefits, which, I'm really encouraged about. There's some programs in the IRA that I hope will also, go to address climate resiliency. So there's a $3 billion fund in there for the environmental and climate justice block grants. Hopefully, there's some application of that for community resiliency. But that combined with the infrastructure bill that took place earlier, I hope will bring some much needed investments to, historically underinvested communities. So there's, the legislation piece and the funding. There's also, things that are being done on the policy and structural side too. So, we've had the creation of the Office of Climate Change and Health Equity, the launch of the Justice of 40 initiative. And I think these will definitely help as well. And they demonstrate, an interest and leadership to address these issues. So I'm hoping, it seems like we're going in the right direction. So I hope this continues.
Great. So some of these initiatives are bringing together kind of the whole healthcare value chain to try to reduce some of these impacts and do no harm. All right, so before we take some questions from the audience and participants, what final thoughts would you like to share with our audience? Keep in mind, we have a very wide diversity of people listening in from all over the world, including employees. We have company representatives from all different industries, sectors, locations, students, academics doing research. And I would ask you, what is your personal call to action? Phil, would you like to start with that?
Sure. I just touched on it a little bit, but, we need to not only address climate mitigation, right? We need to keep our foot on the pedal. We need to smash it down to the floor. We need to keep going as fast as we can to mitigate climate change and really decarbonize society. But, we also have to be very cognizant of, the current climate. And I'm talking about actual climate, not, social or political climate. And realize climate change is, impacting how we live now. And we need to be more resilient. So I know it's hard from, many perspectives to focus on many things at once. But, we need to have this parallel path of building resiliency with mitigating climate change if we're to come out the other side at some point in the future and in decent shape as a society. So that, we have to become masters at doing many things at once and doing it well. So
when we were talking earlier, I heard about that example from one of you about Australia, which was agreeing to take in one of the island nations when it goes underwater. I think, Kristen, you were talking about that. That's
Yeah. I mean, there's some great forward thinking going on out there, looking ahead to what are going to be the impacts and how is this going to be dealt with. And that's the kind of big thinking that we need, and we need to start sorting these things out now. Because especially when you look at issues of migration, those, the more it's a surprise, the harder it is to deal with. But there is a lot of great science out there showing where and how the world is changing. There are a lot of good models out there showing the impacts. And what we need is, like I said before, this is an all hands situation. Everybody has something that they can bring to the table. This isn't, I was talking with somebody the other day about college students. This isn't a situation for STEM majors alone to deal with, right? This is for everybody. These are the decisions that we make in our daily lives. These are the decisions that businesses make. These are the decisions that we as voters make. These are the decisions that are made at community councils, at state legislatures, at national governments. Like this is happening at all levels of society, all levels of government, all around the world. And there's a place for everybody in it. And it is something that impacts all of us. Nobody is going to be exempt from this. I have said before that if you didn't like COVID, you're going to hate the climate crisis. Just a little bit of what we saw in COVID is going to be magnified even more by the climate crisis. Supply chain shortages, disruptions to normal operations, disruptions to how we live and work and where we live and what we do. All of that is changing as we speak. So there is a place for everybody, and we need to find it and dig into it.
Absolutely. And every choice you make at the supermarket or the drugstore or a retail is affecting these issues.
Yes.
And so what about the focus on products and healthcare's footprint and how companies like Johnson & Johnson can decarbonize without impacting patient care and how it's being addressed? Phil, do you want to comment on that?
Yeah, I mean, the healthcare sector needs to contribute, in quite a few ways. I mean, first, as you mentioned, like do no harm, right? So we need to rapidly decarbonize how we provide care. Second, I'd say we need to, be more resilient again as a sector to be able to provide reliable quality care in the face of a changing climate. And then, as a healthcare sector, we also need to look forward to the future and anticipate how, climate change will shape human health moving forward. And we got to work on developing the solutions and systems that will keep people healthy and well in a changed climate. That touches back on Kristen's points about, not only looking at how health is being impacted now, but trying to project forward and anticipate, future changes. So, yeah, there's big challenges for the healthcare industry moving forward.
The challenges are enormous, but also the opportunities are enormous. So, Kristen, what final thoughts do you have about what we can do about partnerships and emergency management? And you mentioned something when we talked earlier about stone soup.
Stone soup.
I'd never heard before.
For anyone who remembers that children's book, it was a story about travelers coming to a village and looking for soup, and the villagers not having anything for them, and so they said they were going to make stone soup, and so they put a stone in a pot, and they were like, "Oh, this is really good. If only we had some carrots." And then all of a sudden, the villagers were intrigued, and they threw some carrots in the pot, and they're like, "Oh, it's so good. If only we had some cabbage and potatoes." And soon more and more people were throwing things into the pot, and all of a sudden they were feeding the entire village. And that's what I think about with this, is that everybody has something to throw into the pot. It is about the power of partnerships. I see in the chat, somebody asked a question about If the people most likely to be negatively impacted are included in the conversation, working towards solutions. And, that is something that we do in our work, working with the health centers that we work with. And that is something that, we have engaged with patient populations before as well. But those are the most important solutions, are the ones that are designed with and for the communities that are most impacted, because they know what the real impact is. They have ideas on what the solutions are. So it's, this top-down, outside-in approach. That's not the recipe for long-term sustainability, right? So we're trying to bring together local knowledge, local expertise, best practices, resources, all of that together for community-wide solutions.
Wonderful. Thank you so much. I love that story. It's very profound to think about the stone soup as the metaphor for where we are. So it's 12:51, and I think we have a few questions from the audience. So unless either of you have something else you wanted to throw into the pot, let me see if we have any questions. I'm going to look at the chat.
Yes, Gina, there's a few questions in the chat.
Okay. Any particular you want me to focus on?
Barbara Clark asked if the people who are most likely to be negatively impacted are included in the conversation and if they're involved with working towards a solution.
Excellent question. Okay. Thank you, Barbara. Kristen, do you want to respond to that?
Yeah. So I did touch on that a little bit. Of that is part of our partnerships with the health centers that we are working with. So for our particular project, that is part of designing it in partnership with the health centers, because the people who work in those health centers live and work in those communities. And so we are really focused on designing solutions for the health centers who are embedded in those communities. So that's a built-in part of the project that we are doing.
Great, thank you. Khushbu Patel asked a question here about the COVID crisis. How are the learnings from the COVID health crisis being leveraged to strategize and predict how climate change will impact healthcare and contribute to health inequities?
That's a great question. I would say that the learnings from the COVID health crisis have not been, much has been documented, not a lot has been synthesized, and it is still an ongoing emergency in many ways and in many places. I think that one of the things for me is that it gives us a real insight into what true stresses on the healthcare system look like, and where the real challenges are. And it gave us real insights into the impacts of politics on health. It gave us real insights into supply chain challenges. It gave us real insights into human behavior. It gave us real insights into the challenges that healthcare workers themselves face. Remembering too that healthcare workers are people too, and they are getting sick and dying too. In the earliest days, they were the ones who were being most impacted. And we will continue to see that as well. So I think in many ways, it was a real preview that we need to be paying a lot closer attention to and trying to apply those lessons, because we're going to be seeing more of that.
Great. And I'll just add to that, I'm sorry, that at our next webinar, Jessica Johnston from Becton Dickinson is going to be actually talking about lessons learned from COVID and their experiences at BD. Go ahead, Phil.
I was just going to say, from the environmental side of things, I mean, we saw that, rapid decarbonization can lead to, clean air and blue skies. Now,
Oh yeah,
that's
that
not,
was amazing.
That's not the way we want to, go about things, but it gave us a window into, what could be. So, and that I think gave people hope. And again, as Kristen said, people are still crunching data, right? COVID changed all kinds of ways that we interact and our relationships with the environment. People accessed outside more, they wanted to get outside as part, to support mental health, right? Get out and walk and be in nature and things like that. COVID changed a lot of things, but we're still really trying to understand how it, fully changed our relationships and whether those changes are going to be durable or not. So I know there are a lot of studies ongoing to see whether some of the changes are durable.
I think that's a great point, Phil, because it's so often on the environmental impact can seem so large and impossible to change the air quality, right? And then all of a sudden everybody stops driving, and all of a sudden air quality has dramatically improved. We know that everybody stopping driving is not a long-term permanent fix, but it does take it off the table of these are insurmountable issues, right? It really showed us that human action, individual action, collective action can really move the needle. So I think that's an important lesson for us to have recognized that change is possible. Again, those things aren't necessarily long-term solutions, but it is possible.
I love that. Thank you so much. We have this will be the final question from Christabel. What, if anything, can we do now as individuals, in addition to voting, volunteering during disasters, and a few of the things you've already mentioned, to start taking action to help? Love that question.
Great question. So I think one of the biggest things is being informed. Stay informed. Understand what is happening in your community, in your state, in your country. Get involved. So you listed some of the ones that we've talked about, but it really starts with being informed, talking to people about the issues, understanding the impact of issues of everything from community ballot measures, if that's something that's happening in your community, to purchases that you make, to looking at things from environmentally responsible living, right? Reducing your energy bill, reducing fuel usage, reducing, there's so much that we can do on that individual level. But so much of this is also at the larger scale level of government and business and corporations, and understanding what those sort of trigger points are, what those inflection points are, and where action can happen there.
Wonderful. So we'll be posting some resources related to that. We actually, my team produced a personal sustainability guide with lots of specific suggestions about what you can do at an individual level. And then at the corporate level, we'll be posting the leading companies' various initiatives to look at. And I thank Peter for this wonderful comment about today, great learning. We face many environmental and social issues in the EU and Poland. I learned a lot about the need for partnerships, cooperation, joint use of resources, and we'll use those ideas in my teaching and management practice. Thank you so much. Thank you all. Great. And we will send out the resource list that I mentioned. There'll be a page with the recording, with a whole resource list repository we worked on for several months. And I had a student, Yuri Yarmish, I want to acknowledge, who helped with that over the summer. And I also want to mention the upcoming 2 webinars on October 7th. I hope you'll all join us for Health Equity, the role of business in building healthy communities. We were going to have Manan Shah from BMS and Jessica Johnston and Ellen Rafferty from BD. So we look forward to seeing you on October 7th. Thank you so much. And thanks to Phil, and thanks to Kristen and everybody who participated. Thank you so much.